To everyone, we're excited to be here. This is the first of a few lunch and learn opportunities that we'll have scheduled throughout the year, but we're excited to kick it off with 201 Awareness Day today. So to begin, we'll just do a few quick introductions of the people that will be speaking today. I'll go ahead and get us started. I'm Sheridan Threadgill. I'm the Community Engagement Coordinator at the United Way, Kishwaukee United Way. I've been here a little over a year. So, Gretchen, if you want to go next.
My name is Gretchen Sprinkle. Excuse me, I'm getting over a cold. My name is Gretchen Sprinkle, and I'm the Executive Director of Kishwaukee United Way. Been with the organization for 7 years, but serving as Executive Director for about 1.5 years now.
Awesome. Paul, you can go ahead.
Hi, I'm Paul Callaghan. I'm a volunteer board member with Kishwaukee United Way, and I also serve as treasurer for the United Way of Illinois, which is the statewide advocacy group for United Ways. And Violet, I think that leaves you next.
Hi, thanks, Paul. I am Violet Pavlik. I am the Director of Database Services at Path Inc., which is the answering services for 211 for most of Illinois.
Awesome. Thank you all. So we do have a few poll questions today. This first poll is just to get an idea of who all we have in the room. So if you don't mind just answering and letting us know what role you play in the community, just so we can get an idea of who is all here.
Hey, Sheridan, on my end, I don't have the polls to share. I don't know if you can do it from your controls, but it's not in my toolbox.
Yes, let me see. There we go. Is it there? Yeah, okay. Awesome. So a lot of nonprofit service providers, a few community members. Awesome. Well, regardless of the role that you play in the community, we hope that you will find something useful and are able to take something away from our webinar today. So a quick overview of the agenda. I'll kick us off with just an overview of 211, and then we'll have a presentation from Violet on PATH and the role they play in bringing 211 to our community. Then Paul will go over advocacy efforts in Illinois, and Gretchen will wrap us up with going over the fourth quarter report and maybe some data trends for our community. And if there's time, we'll have a short Q&A, but if you have questions throughout, feel free to put them in the chat and we'll try to get those answered for you. Another poll that I will go ahead. Oh, there it is. So just to see how familiar you are with 211. And if you've ever referred someone to 211. So most people are pretty familiar and are referring people. So that's good to know. Glad to see that. Great. All right. So to begin, I'm just going to go over kind of a little of the background information about 211. So following the lead of United Way of Metro Atlanta, in 1997, the United Way of Illinois, which is a statewide coalition, began working with the Illinois Alliance of Information and Referral Systems, also known as AIRS, to bring 211 to Illinois. Legislation passed in 2003 that created the 211 Collaboration Board to guide the state's pilot 211 program. And Governor Quinn signed the 211 Service Act that prompted the planning and implementation process for 211 throughout the state.
Huh?
Um, 211 was brought to DeKalb County in 2017 after many conversations. The Fairdale tornado of April of 2015, which some of you may remember, really prompted local efforts to bring 211 to our community. Supporters really saw the benefit of having one central location for disaster and crisis relief information. So what is 211? It's a free information and referral line that is available 24 hours a day, 7 days a week, 365 days a year. Anyone in DeKalb County can dial 211 from their phone or the alternate 888 number and access 211 services. When callers call 211, they are connected to a live operator who will connect them to resources in our community. Fairly new, 211 is also available via text. So you can text your zip code to 898-211 during the week between the hours of 8:30 and 4:30 and be assisted in that way. And then you can also access 211 on the web. Service providers can update their listing anytime to make sure that callers are getting the most up-to-date information. Any nonprofit or organization that offers free or sliding scale services can be added to the 211 database. And there are some other things that go along with that I'm sure Violet could speak to if needed. But 211 was really developed to be that central hub and location to access community services. Locally, our 211 program has an operating cost of about $6,000, and we did just want to acknowledge our ongoing supporters for 211 in our community, the DeKalb Township and Northwestern Medicine. I think it's kind of important to mention what 211 is not, just so that callers and those referring callers kind of know what to expect when they call 211. It's not a replacement for 311 or direct services that nonprofits provide. It's not an emergency assistance or dispatch line. Always encouraging callers, if it is an emergency, to definitely call 911 because 211 is for non-emergent needs. It is not a surveillance tool or an evaluation of services for things being provided in the community. And it is not a counseling or mental health support service. So this slide just kind of gives you an idea of what a typical 211 call might be of. As you can see, there's an array of things that people can call 211 for and get access to help with. So we will, after this short video that Path provided us to, we'll hear from Violet. right. Violet, the floor is yours.
Thank you. Well, happy 211 Day, everybody. I'm very happy to be here. So my presentation is just going to kind of go a little bit more in depth to what the video had to offer, just a little bit more details, and hopefully I can answer any questions that you might have about PATH or 211 as well. So if you want to go to the first slide there. Okay, so PATH, what does it stand for? So PATH actually, the mission of PATH is really simple and it's in our name. PATH stands for providing access to help to improve and save lives. And the main way that we do that is through our 211 call center. And on this 211 line, so there's basically two types of calls that we get, which is information and referral for all those health and human services, and then also crisis support. So if someone's just kind of going through a tough time and they want someone to talk to, we're here for them as well on the 211 line. Okay, next slide would be good. Okay, so the evolution of PATH, so basically just some background about PATH. We started out actually in the 70s as a drug crisis line in our local community here in Bloomington for the Illinois State University campus. And then that just kind of naturally evolved into information referral and eventually 211. So in 1971, we were officially founded, and last year we celebrated our 50 years, if you can believe it. I still think like 70s are, that's 30 years ago, but that's 50 years ago now. And today, if you want to just go back a little bit more. Oh, there we go. Yeah, so today we do offer 24/7 support, and we're accredited by the American Association of Suicidology, so we can help people going through crisis and experiencing thoughts of suicide. And then we also are accredited by the Alliance of Information and Referral System, or AIRS, and that is the kind of nation and worldwide actually accrediting body for high quality information and referral. And now we answer about 45,000 calls annually, sometimes a bit more. I think last year was a bit more than that. And that is pretty much where we're at today. And we can move on to the next one. Okay, and then just those three main ways you can access our 211 services. Again, that was in the video. So you can call 211 anytime. We cover over 50 counties in Illinois. And then there's some other vendors in the area, but eventually, hopefully one day, 211 coverage will cover all of Illinois. And then we have our online database, which you can find by going to www.findhelp211.org. And then just like in the video, you enter your zip code and search for services similar to how a call center specialist would, but you can just kind of do that on your own. And then also texting is available right now just during business hours, hopefully eventually 24/7 as well. And to get started, all you would do or refer someone to do is to text your zip code to 898-211. Okay, and then in this slide, I just provided some links and resources to all those to our website, the online database again, and our phone numbers. And I don't think I included my contact information, but if you need that, I can put it in the chat if anybody needs that. And that hopefully is just a helpful resource for you moving forward. And that is pretty much all I have for you guys today. Thank you so much. And if you have any questions during the Q&A portion on this section, I'd be happy to answer that.
Awesome. Thank you so much, Violet.
Yeah.
And then Paul, you're up.
Well, thanks, Sheridan. And welcome aboard too, Violet, to your new position. I know you have had some changes down there at PATH, and this is a new role for you. So we're very happy to have you with us and appreciate the information you're providing us. As Sheridan mentioned, the 211 Information and Referral System was launched in 1997 with United Way of Atlanta, Georgia, as a way to provide the coordinated, up-to-date information on local health and human services. It became a nationally designated system through FCC action in 2000. The shades of blue on this slide will indicate the extent to which 211 is accessible to a state's population. And the dark blue is where it's fully implemented. And right now, 96% of US residents are covered by 211 service. Unfortunately, Illinois is lagging behind the rest of the country, and Chicago is the largest metropolitan area without 211. Next slide, please, Sheridan. So unlike other states, the Illinois model for supporting 211 relies solely on local United Ways finding mechanisms to fund it. On this map, areas in white and gray do not have full 211 services. Will County to our southeast is just starting their 211 service, and the United Way of Metropolitan Chicago is working on a plan for Cook and DuPage counties, but that leaves a large part of the rural part of the state that is not covered and needs some type of implementation. And it is most challenging in those areas simply because of the volunteer size of United Ways and the resources available and the challenges that are out there when it comes to switching stations for telephone companies. Next slide, please. Fortunately, from the United Way of Illinois standpoint, there's a champion in the legislature that really wants to see 211 fully expanded, and that is State Senator Melinda Bush from the Lake County area. So the United Way of Illinois, working with other partners and the 211 board, did come up with a 3-year budget for full implementation. And it was estimated that $1.8 million would be needed for 1 year to get all of the systems up and running, not including Cook and DuPage counties, which is being done separately. So we have State Senator Melinda Bush from Lake County and retired state representative Elaine Neckritz, who are leading the legislative effort to get 211 implemented statewide. I can tell you that local meetings have been held with Representatives Jeff Kiker and Tom Demmer, as well as State Senator Dave Severson, all who serve DeKalb County. They understand 211, they're supportive of 211. However, it does remain to be seen how 211 funding would fit into the priorities of the next state budget. So discussions are underway. They're expected to continue on through April, and we will just have to see what happens. But even if it doesn't get included in this year's budget, and recognizing the challenges of having to go through another budget that's been impacted by COVID, there is a plan out there now that shows a path on how 211 can get implemented statewide. And you can be assured that from a state advocacy level, United Way of Illinois will be representing all of our United Ways to try to make that happen. And now I will turn it over to Gretchen.
Thank you, Paul. So the fourth quarter for DeKalb County saw 213 total calls and 2 texts. I'm actually kind of impressed by the 2 text messages sent because we have not been advertising that very much. And 26 of those contacts were related to COVID-19. We also have the chance to see how many calls had unmet needs each quarter and what those unmet needs are. Since the implementation of 211 in DeKalb County, those unmet needs have overwhelmingly been things like rental assistance, transportation, and hotel vouchers. This is particularly true since the start of the pandemic. as you know, there have been restrictions on how many people our emergency shelters can have while remaining a safe distance and not exposing residents to COVID-19 more than absolutely necessary. The request for those hotel vouchers has gone up. As we look at this 211 data, we are regularly trying to find the best way to meet those unmet needs. Here we go. Thank you, Sheridan. So as you can see, the top requests for 2021 were for rental assistance and motel vouchers, utility bill assistance. Those are things that we expect pretty regularly, but also a lot of calls for mental health or addiction help. We know that across the board, the mental health services in Illinois and the country are very strained. There's been a greater need of those since the onset of the pandemic, and a hard time retaining professionals in that field. So one of the beauties of 211 is, rather than guessing what the needs of the community are, we get to see the data so we can try to work with other community organizations to fill in those gaps. Most callers in DeKalb County are a self-referral when they dial 211. And United Way funded agencies are consistently among the top referred agencies. A lot of our partner agencies provide things like rental or utility assistance, emergency shelter, mental health support. And 211 remains a consistent resource for callers to get COVID information. At the onset of the pandemic, PATH stepped up and became a place that callers could get up-to-date COVID-19 information. So it's been nice to continue to refer callers there and kind of ease the load on our local health departments.
Awesome. Thank you so much, Gretchen. And just a few things that you can do to kind of support 211 efforts is know and spread the word about the 3 ways to contact 211. We saw that most people are calling 211 on their own. So making sure that our community knows how they can get in contact with 211 is important. I think the text messaging option is great. It's especially since, you know, someone might not have time to call, but they can certainly send that text message and get the help that they need during business hours. And then also, when you use the 211 database online, you're able to email those results to you or get them sent via text, so they can refer back to that information when needed. So making sure the people in our community know how to access 211 is important. And then spreading the word to your family, friends, and colleagues who may not even know what 211 is. And if you are a service provider, I can't stress it enough how important it is to keep your listing up to date. 211 only works if we're, you know, giving up to date and current information. With COVID, we know that a lot of agencies changed resources, added resources, and took resources away. So making sure that that listing is current and up to date is very important. And then just considering how you can support 211 in our community, whether it's contributing to the operating fund, passing out 211 information, what role can you play in helping us spread the word? And then now we do have some time to take any questions that you might have, or any comments that you would like to make. I know we are always working to see how we can better spread the word about 211. So we would be interested in knowing what you think is the best way to spread this information throughout our county. So the poll is up if you want to put it that way, or if you want to unmute and share your perspective, you are welcome to do that.
Well, Sheridan, while the poll is underway, I think there was a strong endorsement of the concept of the nationwide common phone number of 211 when it was decided for a suicide hotline, they were going to implement a 988 number. And Violet, I don't know if you're able to do this or not, but are you able to perhaps address the structural changes being looked at by PATH as that system begins to get rolled out?
Yeah, so we're still in the very early stages of all of this, but PATH has been awarded the NOSA and contract for providing 988 services in Illinois. So that means that previously 211, the way that we kind of functioned here is our 211 specialists were fully trained to do information and referral, suicide, crisis support, and everything that came with it, because we did also answer for 9 counties on the National Suicide Prevention Hotline. Now that we have 988, that's going to be separated a little bit, so we will be answering for the entire state pretty much for 988. And the way that we're going to train our staff is there's going to be kind of a separate 211 training where our staff and volunteers will be trained to handle information and referral calls primarily, and then they'll be trained to de-escalate certain situations. If they get a crisis call on the 211 line, then they can de-escalate, provide some comfort, and then transfer to the 988 line that other operators in our call center will have. And then the 988 specialists, they'll have specific crisis training and our suicide training.
Awesome. Thank you for
I
that.
do have I was going to say, I have a quick question. It's about the service provider part of it. Can you guys share how you guys find service providers or how they can connect with you? And then what is that criteria for them to be able to be listed on 211?
Yeah, I can definitely answer that. So when we add a new county, so for instance, we just added Will County to our database, we first work with United Way and other stakeholders in that area and to see if they have any existing lists already. So for instance, Will County, they already had a crisis line that was there before, but they went out of business. So they had an outdated list, but that gives us a starting point. And also any services that United Way funds, we ask for those services. So we start compiling a spreadsheet of all the services that are already known in that area. And then we just do a lot of our own research too. So we have a list of all the essential needs and agencies that we know of for counties that we need. So all the shelters, the 988 centers, hospitals, rent and utility, food pantries. We just search that out, try to find people who are on the ground in those areas and see what resources are there. And then for the inclusion, exclusion part, we have a document that's on our website that outlines exactly what agencies are going to be included and excluded in our database that follows those AIR standards again. And in general, we will include non-for-profit agencies or services that offer no charge for their services or low cost sliding scale fees.
It's perfect. Thank you.
Yeah.
While we're on the topic of those listings, Sheridan mentioned how important it is to go in and update your listings if you are a service provider in 211. And I have found that if you find the same time every month to go in and check, then it's not such a huge project. So for instance, every time I do bank reconciliations, the same day I check the 211 listing. So just a way to make it not seem like such a Herculean task.
I would agree with that. And I think it's fairly easy to update your listing. I think there's an information form that you can fill out, and then PATH will get back in touch with you. And there's also login information, if I'm not mistaken, that you're provided with that is the same. So it's always the same. You can always access it that way. So.
Yep, absolutely.
Yeah, that's correct. So yeah, once you're in the system, you have a PATH login page with your username and ID, and then you can update it at any time. And we are required to update all our listings annually. So even if you forget to update us and send us that information, when your anniversary date for the last update is due, you'll get an automatic email with your username and password and link, and we'll just remind you to go in there and update the listing. And then if we don't hear back from people, or if the email bounces, then we'll reach out by phone or email, other means as well.
I will personally add that Violet is great at getting back to you. So I appreciate that. She made the video that we saw earlier, which I truly appreciate. So they're definitely easy to work with, and we appreciate that. Are there any more questions or comments or concerns? No. I don't think I have anything else. Gretchen, did you have anything else that you wanted to add before we wrap things up?
I appreciate all of you taking the time to join this Zoom call and learn more about 211. I encourage you to, if you're a service provider or an employer, to make sure those you serve or your employees are aware of 211. We can get you the little business cards, so they're easy to hand out. And also be sure to look out for more emails from Sheridan about Lunch and Learns coming up on other topics throughout the rest of the year.
Awesome. Thank you, Gretchen. Well, today, in the spirit of 211 Day, I encourage you just to share some information about 211 with colleague or friends, so that we're constantly making people aware of this service. I appreciate you all coming on, and I hope you have a great weekend.